All right, thanks very much for being here. We're still waiting for a few people to join in on the call, and they'll all be joining shortly. But I see that we're going to go a little out of order. We had some people in order, but that I sent, but you know, it's a Monday, and so I'd like to start, if we could, with our ITD director, Eric Chatham, to talk about how the county is staying running with technology during the COVID crisis. We'll be joined later on by Charles McKee, Supervisor Lopez, and Dr. Moreno. But let's start with Eric, who can give an inside view of how the county's running during COVID. Unmute.
There you go. Got to use technology properly. Got to unmute. So good morning or good afternoon, everybody. I'm Eric Chatham. I'm the Director of Information Technology Department here at the county. I'm just going to give you a quick overview of what the county's been doing from a technology perspective and how we've been able to leverage the technology so that staff can be deployed anywhere in the county and or at home so they can support both internal operations and the public. So about 4 years ago, we started a major technology transformation within the county to allow employees to work from anywhere, anytime, and any place, and on any device. This was driven to lower our costs and improve our services so that we can access information and provide access to information to all of our constituents. We built a world-class secured network that connects all the county facilities and agencies. We implemented a voice over IP system that allows all of our telephones to be accessed remotely as well as be transferred across the internet. We improved our access to wireless, both for county and for public access, so that all mobile devices could be implemented and used throughout the county. And we also deployed a state-of-the-art radio system to support all the public safety agencies and first responders. With all of that infrastructure that we deployed, we were able to move all of our county applications to, or many of the county applications today, to a software as a service platform. We call that SaaS, which is allows all of our services, primary services, to be accessed over the internet. Some of the services that you've seen we're using continually today, as our county mail system was migrated to Office 365, which allows access to mail and all of our Microsoft products such as Word, Excel, PowerPoint, and all of our data across SharePoint, where county employees can use that from any location that has an internet enabled device. Obviously now you're watching us use our video conferencing solution, which was Zoom, which we've used within our different, what we call Zoom rooms, which are many of our conference rooms, as well as it's been deployed to all the local PCs, laptops, and mobile devices so that we can have remote meeting attendance, as well as sponsor webinars across that, as well as deploy many of our board meetings. Our global information systems, our GIS systems are all SaaS enabled, which allows for easy access to parcel information. Our agenda management system is available for board meetings and board reports. Our learning management system allows all county employees to access their required and educational training courses. So we've been able to enable many of our different applications to be SaaS enabled for both county employee access as well as public access. So when the shelter-in-place orders came, the county was able to quickly leverage all of these technologies to deploy our employees and continue to provide services to the public from any location. With secured access to the internet and web-based systems, employees can access all their mail and documents. They can digitally sign documents for approvals. They can stay in touch with their work groups by using Microsoft Teams, and they can attend virtual meetings via Zoom. So in essence, county employees can continue to provide services to the public the same way they did as if they were sitting in their office. We then adapted a lot of these existing technologies to handle things such as how do we allow the public to still integrate with our county board meetings that used to be in person. And we were able to leverage the Zoom technology and some of the webinar features, as well as to allow the public to participate in the meetings. We've also increased our use of digital signatures so we can allow for paperless processing of documents. And our website, co.monterey.ca.us, is continually updated to provide current information as we have available. You can still use our mobile app, Monterey County Connect, so that you can access additional information. And every day we look at new ways to leverage existing technologies or new technologies so we can improve public access and the public interaction. So with that, I'd just like to thank the Board of Supervisors for continuing to support our technology projects. I'd like to thank the department heads and elected officials for partnering with the IT organization and delivering solutions that support their businesses. And also to thank the ITD staff for delivering technologies that have enabled the county to deliver services to the public. And with that, I'm open to any questions, or we can hold them till later.
Let's hold them to later for the moment. Todd Keating, who's the interim probation chief, is also on the line with us today, and he's going to be talking about probation services in the time of COVID. And thanks very much, Todd, for joining us.
Hi, it's my pleasure. I'd just like to point out that approximately 70% of probation staff are working remotely at any given time. That's the exception to that would be the institutional staff at Juvenile Hall and the Youth Center, who don't have that capability, obviously, since they're taking care of the youth that are in custody. At those two institutions, we have suspended all visitation, which was a difficult decision, but a necessary one. And juvenile halls up and down the state have done that, essentially, so we limit the number of people coming into the institutions. To mitigate that, we have given the youth free access to the phones, and we do have some video conferencing capabilities so they can maintain contact with their families. All programs from outside vendors have been suspended, again, so we can limit the people coming in and out of the institutions. Probation staff are now running all programming at this time. We've worked with Natividad Medical Center, who is our medical provider at the institutions, to develop protocols dealing with intakes and to prepare should any youth exhibit signs of illness. Everybody who enters into the institutions is medically screened, and that includes taking temperatures. At our juvenile hall and adult offices, we are limiting persons allowed beyond the public lobby area to those who are court ordered. And most of those are monitoring type people who are, need to be hooked up on the electronic monitor for home confinement. And we are maintaining contact with our clients, mostly through telephone, but other electronic means as well. Juvenile hall and adult court are also being held remotely, and we have staff that attend those hearings remotely. And like Eric pointed out, his staff has been awesome with getting us up and running. It really has allowed us to operate from home when possible, and it's been fantastic.
Oh, great. Thanks very much, Todd. We are still awaiting some of our other staff people, and so we normally would have everybody give their presentations and then open the floor for questions. But if there are any questions for Eric or Todd right now, why don't we take those questions while we're waiting? Sarah, you have a question.
I do. Thank you, Maya. My question is for Todd. Can you tell us, I think all of us have reported a little bit on changes at the county jail designed to reduce crowding there. Are there changes happening in your institutions for youth as to who is released and how many people are currently in custody there versus the average?
Yes, we have limited the who we're going to take in the institutions. We've pretty much put a moratorium on violations of probation when that's the only misconduct. Unless of course it's some sort of public safety issue. But essentially everybody that's in the hall right now, it's I think today we're at 20, and on March 17th, before all this started, we were at 50. So we've really clamped down the front end. people have cycled through their natural cycle of being incarcerated, which, the average is not very long usually at juvenile hall anyhow, but the people who are there, they're either pending something serious or they may be awaiting placement in a group home, which the group homes have also sort of shut down with their intakes. So that's where we are with that.
Thank you, Todd. Are there any other questions for Todd or Eric? All right, thank you. And I see we've been joined by some of our other county staff. So, Todd and Eric, you can take a break and sit back. Let's go back to our original order and check in with our County Administrative Officer, Charles McKee, for just an update on what's happening this week.
Thank you, Maya. Sorry for that delay. I appreciate Todd and Eric standing in for us. I think the update for today is the continuing efforts to make sure that we have the right plans in place. I think as many people have heard over the last few weeks are the need to plan for potential spread of the novel coronavirus to the homeless community, the housing vulnerable, and those who are in congregate living situations that make it more challenging to have social distancing, and also those who might be in a compromised health capacity. So we want to make sure that we're addressing all those, and we are looking at a variety of tools to address those needs. I think we've heard recently about additional trailers coming to Monterey County, and they're coming from the state of California. The state of California is the one that is procuring those trailers. We look to be getting somewhere between 90 and 100 trailers, and they are hopefully arriving this week, but the timing is still up in the air a little bit. And we're going to try to deploy those strategically throughout the county to best address the needs that we see coming down the road for the coronavirus and those with housing vulnerabilities. And we recognize that could be a moving target somewhat, depending on if a different population is experiencing an outbreak or another. In addition, we're looking at some sites. There have been a lot of talks about sites in Salinas, sites on the peninsula, sites in South County, to stand up as more larger situations to provide some stability to those with housing vulnerabilities. And those sites are going to be evaluated to see what fits the need the best at the time. And so it's kind of a fluid situation to time it, to address the population and have the right resources in place. And then finally on that, we are looking also at the need for a potential alternative care site. And I know a lot of people have heard that throughout the country, and you have the Navy ships out in helping out in New York, and I think one is now here off the coast of California to also help potentially as alternative care sites. And the idea there is to hopefully put patients that are in hospitals or don't need intensive care type of treatment in a hospital, but might need some alternative care at this time. They have some sort of illness. It might not be COVID-19, but it might be something else that they're seeking care for. It could ultimately be COVID-19 also, where they don't need intensive care, but they need some hospitalization or hospital type care. And so we're looking at trying to stand up that kind of an operation. And as you can imagine, it's not a simple endeavor. I think as somebody said recently that, they plan all year to put the jazz festival on or some other festival on, and it's a big undertaking. And we're trying to put up an undertaking like this in a very short period of time. We've had some great collaboration and cooperation from different entities throughout the county. Most recently, the city of Marina, and we'll be talking a little bit about more about that tomorrow. And the need that we have here in Monterey County is going to be driven by the ability of our community to maintain the social distancing part of the health officer's order. The more that we can maintain adherence to that, the more likely we will not need an alternative care site. And my point there is that if we have a surge, the surge is more likely to happen. We can have Dr. Moreno talk more about this. The surge is more likely to happen if we don't adhere to the health officer's order. And if we don't have a surge, then the capacity that we have in our hospitals should be sufficient. And they have additional capacity in their hospitals right now, the 4 hospitals, to handle what we're currently seeing, and we want to maintain that. And that means adhering to the health officer's order on distancing. And that's a critical message that we want to get out there to the public. That's the key to having the resources available in our community to help those who get sick. We want to maintain that. And that is not just sick with COVID-19. It's anything else that might cause you to need hospitalization, so that we want to make sure that their hospital beds, if you or a loved one have a stroke or a heart attack, or you break your leg, or you trip and fall, or you have some sort of other illness that causes you to have to go into the hospital. The hospital bed need isn't just COVID-19, it's for these other issues too. We want to make sure that the public is aware of that. And then finally, there are needs throughout our community in the nonprofit world that are struggling to maintain services that go to the needy in our community. Most recently, we're hearing a lot about the food bank and the food pantries throughout the county. And the pressure that's going on to those resources is tremendous, because there are many in our community who have lost their jobs and are, for the first time ever in their life, looking for the assistance that we as a community can provide. And I know the Board of Supervisors has been generous in trying to help out the food bank, and I think they will do so again soon. We're gonna make sure that we have food for those in our community that are not just housing vulnerable, but now food vulnerable. And that's just something we don't want to see in our community. We want to make sure that everyone has the resources available to them. So with that, Maya, I will turn it back to you.
Thank you. And this is a perfect time to check in with Dr. Ed Moreno for an update on public health.
Hi, good afternoon, everyone. Hope everyone's doing well. We have updated our website to show the total number of cases that are confirmed every day. And our most recent number shows that we have 87 individuals that were confirmed, and still with 3 fatalities. And we continue to report on various demographics of the people that are confirmed. Among race and ethnicity, that's been people been asking about that. About 51% of the 21% of the cases are still under investigation. So we only have information today on 80% of that group. Among that 80%, 51% are considered Hispanic, 18% non-Hispanic, white, and others. So you're welcome to go and look at that and other updates there, as well as updates on lab testing. Some good news on the testing front is that California Department of Public Health sent to our county one of the Abbott machines that can test for COVID-19, and it can do so about every 15 minutes. That machine is now with Salinas Valley Memorial Hospital, and we also received reagents so they can test up to 96 patients for COVID-19 and get that result quickly back to the healthcare providers at their facility. So it's good news that our hospitals are starting to get the supplies to use with the equipment to test locally. Let's see, as far as our containment efforts, we continue to contact individuals who were considered exposed to these 87 positives. And to date, we've contacted and are monitoring to some degree over 500 folks who were considered exposed. And those individuals were instructed to stay in quarantine and monitor themselves and report any onset of symptoms during their quarantine and what to do if they've developed symptoms. So those containment efforts are still in place. And as far as mitigation efforts, there's been no changes to the shelter-in-place order that I issued. And the combination of shelter-in-place and social distancing practices in Monterey County, in addition to our contact investigations, have really slowed down the rate of spread of COVID-19 in Monterey County. That's really important because people, our vulnerable population, which are older adults and people with underlying medical conditions, fewer of them have been exposed and fewer of them have gotten sick during this early stages of this pandemic. It's also providing time for our hospitals to fully implement their surge plans. Those surge plans are intended to increase the number of beds or the number of patients that can be cared for at their hospitals. And it's also buying us some additional time so that as a county-wide, we can implement plans to stand up an alternative care site in the event that the surge that we experience actually does exceed our hospital's ability to take care of individuals needing hospital care. And finally, I'm hopeful that by slowing down the rate of spread, we're also buying ourselves some time to arrive at solutions as a nation to increase testing capacity, not just in public health laboratories and commercial labs, but also in our hospital laboratories, which we're starting to see now. And so, and if we can get more testing, that'll also give us more data on individuals who in our communities that might be infected with COVID-19, which then gives us more data that we can work with to better estimate where we're at in the epi curve in this epidemic. So I'm happy to, I'll hand it back to you, Maya.
Thank you very much, Dr. Moreno. We're also pleased to have Supervisor Chris Lopez with us on the briefing today. He is chair of the board this year, and he will tell us more, hopefully, about our board meeting tomorrow, which is going to have a pretty extensive report on COVID issues in the county. Supervisor Lopez?
Thank you, Maya. I just wanted to share with everyone, obviously tomorrow wasn't a regularly scheduled meeting with it being the Tuesday after Easter, but we feel it's really important as a board to continue to provide as much information to the public as possible. And I can't urge strongly enough that folks tune into tomorrow's meeting. I think the information that we're going to share is information that has been sort of hard to put together by a lot of the different teams. It's been a lot of work behind the scenes, and we've heard rumblings about the efforts they're putting together. And tomorrow, those are going to manifest in presentations that will help make clear for the public what exactly we are undertaking as a county and the efforts that we're putting forward. Key to those is obviously the work of Dr. Moreno and Christy Amici, who are going to give us a great presentation on sort of the actual on the ground results of our sheltering in place and adhering to Dr. Moreno's order. And so that's what I wanted to use the time for today here on this call, was just to implore our media partners to urge the public to tune into tomorrow's meeting. It's going to be really critical information, and we hope it's some of the information the public's been asking for and seeking, and through every different channel, whether it's a letter to our offices, a call to our offices, or social media or emails. This is going to be a key meeting in terms of information. So that's what I wanted to share, and I'll be available. Thank you, Maya.
Thank you very much, Supervisor. And that is our presentation. So the floor is open for questions. You're welcome to use the chat feature. You're welcome to raise your hand, or you're welcome to just ask questions the old-fashioned way. I do have a hand raised from Kelly Nix from the Pine Cone. Kelly, go ahead with your question.
Thanks, Maya. This is for Dr. Moreno. The shelter-in-place order has been in effect almost a month, which should mean, I would think, that almost everyone in the county who's developing symptoms now contracted the virus after the shelter in place started. Isn't that correct? And if that's true, what are we to make of the fact that the positives haven't gone down?
So the shelter-in-place order has decreased the rate of spread of the virus, which means that if we hadn't had the shelter-in-place order, we would have seen a lot more confirmed cases, and we would have suspected that would have represented, and hospitalized patients. That would have reflected a greater number of people that in the community that also had an infection, but didn't seek medical care. So that we know that based on our actual experience with the confirmed cases. We still have a ways to go in terms of, as I mentioned, buying time for the hospitals to ramp up to be able to provide the level of care that our community is going to need when we have the surge. I do believe that the models show that we're still going to have most likely to have a surge, and we still need to plan for that surge. And that's really what the modeling is for, to give us some guidance on whether or not, what type of surge capacity we're going to need, and build that up before we get to that point. In terms of the number of cases, because we still have a shortfall in the supplies that we require to do the testing that we'd like to do, we don't have the ability to do surveillance in Monterey County, but there is some evidence from other counties that have tested less people with fewer symptoms, that they among those groups, about 5% of people who have mild symptoms are testing positive for COVID-19. So there's evidence that, yes, there's evidence that more people are getting, or slowly a greater percentage of the population is testing positive. But the fortunate thing is that is increasing slowly, which again protects our vulnerable populations and gives us time to prepare for an increased demand on our hospitals and our healthcare system.
Dr. Moreno, one of our reporters wanted to verify a number that you just gave. Did you say 500 people are being monitored that are considered exposed, and how are they being monitored?
Sure. So yes, the number is correct, 500. 500 is the total number of individuals that we identified with the help of people who were actually sick, and them sharing with us. We were able to identify as people that were exposed, meaning they had a significant exposure, which means that there's a chance that they're going to come down with COVID-19. So some of those people have finished their 2-week quarantine period, but many of the people are still in quarantine. And so we continue to prioritize the individuals that we think are at greater risk of transmitting virus if they get infected. So these might be people who are in long-term care facilities, individuals that are in crowded living conditions, who don't have any symptoms, but they were exposed and they could come down with symptoms. So we have to prioritize who we follow up on regularly. But there are some individuals at lower priority where they were exposed, but perhaps they live alone and they can quarantine themselves. And they have a healthcare provider, and they have a phone, and they could call us or their healthcare provider should they develop symptoms, but they're not going to be around anymore. So those would be like a lower priority quarantine person. So it depends on the degree to which we monitor individuals depends on the risk of further transmission.
Thank you, Dr. Moreno. I also have a question in regarding county parks. If county parks are reopened, if so, why? And if not, why not? And I don't know if Charles McKee would like to answer that. We can also forward that to RMA for a more complete answer.
Yeah, so the parks were closed over the Easter weekend because of the historical nature of gatherings that occur at our parks over the Easter holiday. We understand that that's an important aspect to many people to use the parks during Easter, and it's certainly not a thing we wanted to do, but thought that it was appropriate. That we're going to look at the appropriateness of open parks in the context of the health officer's order, compliance with the health officer's order, and kind of the historical use of the parks and how people are using them, and the type of parks that we have as a county. So we're going to collaborate with Dr. Moreno on the future use of the parks.
Thank you, Charles. And this also may be a question that you could answer. Will the urgency ordinance or on independent lab testing results reporting going forward, will that go forward tomorrow? Why or why not? Or it may be a moot point with the health officer order.
Yeah, we are. That's another good question. We're looking at the need for that ordinance in as you said, in relation to Dr. Moreno's recent order on testing. It might be redundant, and then also there might be some desire from the board to have something in place in our county code in relation to that for the long term. So we'll look at that. I'm not sure how the board's going to, what the board's position is going to be on that tomorrow, whether they want to remove the item and just rely on Dr. Moreno's authority or put something in place. So it's a work in progress, and a decision has not been made.
Thank you. A question for Dr. Moreno. Is there any update on how many people in Monterey County are believed to have COVID-19, even if they have not been tested?
So thank you for the question. No, we don't have an estimate of how many people in Monterey County are actually infected with COVID-19. Again, it's due primarily to the fact that we, as a country, don't have the resources that we'd like to have to do testing on more people, which would provide more data that we could use for estimating the percentage of people who are positive, which would then also inform us as to at what point we might reach, when we might reach a point that we could actually start easing up on some of the restrictions. So unfortunately, we don't have that. I wish we had that, and I'm hoping that the manufacturers of the reagents and the test kits continue to send more of those test kits to our local hospitals, so we can start adding that information to our epi data. Thank you for the question.
Thank you, Dr. Moreno. I have no questions in chat, and I have no hands raised. Is there anyone who has just a question they'd like to ask? No? All right. So then if there are no additional questions, that will end our media briefing for today. And our next briefing will be on Wednesday, the 15th. See you then.
Hey, Mia.
Oh, yes.
Sorry, real quick. I just had trouble unmuting myself. It's Lauren Seaver with KSCW. I
Hi,
have a
Lauren.
quick question for Dr. Moreno.
He's still here.
The nation's projected peak is this week. Governor Newsom keeps saying California's projected peak is mid-May. What's our local projected peak?
So, thank you. So what we're looking at is something very similar to our Bay Area counties to the north. With some of the modeling there shows that they may have their peak in, might be the first week of May. Because we implemented, and those are among counties that implemented shelter-in-place orders after they had several cases. So in Monterey County, we implemented the shelter-in-place order when we got our first case. And so that means that the impact of social distancing took effect probably sooner than our colleagues to the north. What I'm anticipating is that our peak would not be, we wouldn't expect a peak before the larger Bay Area counties, but it could happen around the same time or after that. But I don't have any evidence that from modeling that I would feel comfortable saying that it's definitely going to happen that way.
Thank you, Dr. Moreno. Is there anyone else with a question? Sarah, I see your hand is up. Was that current or past?
That was current. Sorry, I'm trying to figure out how to use the hand raise technology
Me too.
here. Thank you. I have one question for Dr. Moreno and then one for Charles McKee. First, for Dr. Moreno, do you think there might be at some point when we're believed to have passed that peak, any kind of staggered change to the shelter-in-place order where some people may return to work, or are we going to wait until there's a wholesale lifting of the order? And then for Charles and Chris, if you're still here too, I wonder if you might talk at all about whether there will be some kind of public input process for the location of those trailers and what the timeline is for that and how members of the public may participate in commenting on where they'd like to see those go.
All right, so I can start, Sarah. So we are, even though we are still heavily reliant on mitigation, which includes staying at home and social distancing if you have to go out. And again, it's only for essential services. We are having conversations about what information do we have, what do we observe, and what do the models show. And based on that, we do anticipate certainly that there'll be a time when we can start easing up on the shelter-in-place order, looking at other services, for example, that are less essential, but that if they were allowed to resume activities could have a significant impact on the economy, help the economy, or other populations, for example, where social distancing is having a more significant impact on their emotional health and social well-being. Are there significant benefits that we want to focus on first, while monitoring to make sure that release of some restrictions does not put us where we worked so hard to not be, which would be a place where there's a surge and our hospitals can't keep up. So we are having those conversations, and it's important to have those conversations now so that we can, if we are missing data and we recognize that we need some data that we don't have, we can see if we can get that data to help better inform us for those decisions that are coming. Thank you.
So on the trailers, we are still working with the state of California as to the timing of when we receive those trailers. We're hoping to sooner rather than later, obviously, as soon as potentially this week. And I've had a few joking requests to get trailers, people saying, hey, that looks nice, I can get a free trailer, a nice new trailer. But in all seriousness, the locations of those trailers, we're working with some of the various entities that work with the populations that we think might be appropriate for those trailers. For example, the agricultural community and the various groups that work with the ag community and the farm workers to see about where the most appropriate location would be for the ag community if they were to utilize those trailers to help alleviate some of the housing vulnerabilities that farm workers have. And most of the places that where trailers go normally, RVs and pull behind trailers, are more rural areas to begin with. I think people know that we have the capacity at Laguna Seca, we have capacity at San Lorenzo Park, and there's some other areas in the county that have capacity to take trailers. And we're looking at all of those as an opportunity to provide alternative sheltering for those with housing vulnerabilities. But the ultimate locations is being worked out with an eye to those organizations that work with the populations where they might be most appropriately placed.
And Sarah, was there a part of your question about public input?
Yes, I think I'm curious on whether there will be some kind of process laid out by which nonprofits, for instance, or private property owners may, I guess, apply to have a trailer, and if there's a public comment period on this, or is it something that it sounds like your team is just reaching out and doing that and maybe figuring that out on your own. I wonder if the public might see it on a board agenda, or what to expect as far as next steps.
Yeah, I wouldn't see it on a board agenda as far as an action item to say, here, give us direction on where they should go in that regard. We're trying to listen to the people that, first of all, where can we put them? Where are there hookups for trailers, appropriate hookups, because we don't want them just in somebody's field. We don't think that's the most appropriate way to handle it. It's just not, you don't have the services there. You don't have the septic and the power hookups necessarily. And we want to make sure that they're in locations that can handle trailers. In addition, we want to make sure that they're in geographically in the county in a way that doesn't cause people to be driving unnecessarily across the county to get to them if they are have a need for it, but may not be in a quarantine type situation. And then finally, is there how do we best place them in locations where, if there is a quarantine type of necessity, how do we best accomplish that with the location where they may be sited? So we're trying to look at all those avenues, and some of that does entail coordinating with some nonprofits that work with the communities that and the populations that might go into them.
Thank you, Charles. Are there any other questions for any of our participants today?
Mayor, it's Lauren again. I have a question for Charles about sheltering our homeless population. Does Monterey County have a lease agreement with a few motels in Marina, we've heard, to house the homeless population? If so, which 2 motels?
I don't know if we have lease agreements at this point. I'm not aware of any specifically in Marina. I know that we're talking to a lot of different hotels to be prepared, and many of them have come forward to kind of offer up their hotels, motels in this time of need, but not as a general lease situation at this point. I know we're very close to making it happen if the need arises. We want to be kind of nimble and flexible as to when we pull the trigger on needing something like that, because we don't want to tie up something that is unnecessary at this point. So we don't have anything finalized in relation to a kind of a lease agreement in that way. We're talking to a lot of different hotels and motels so that we're ready should we have the need.
Thank you. Any last questions? No sounds of unmuting microphones. So then that will do it for our media briefing for today. Our next briefing will be on Wednesday. Thanks for joining us.